A warm good evening to all dear delegates. Yogya webinar series has reached its fifth session today. All of you who had been there throughout our journey and still with us, we owe you our deepest gratitude. The previous classes had been great success, and we hope the same for the future sessions as well. So, moving on with today's session. Every Ayurvedic practitioner, every student knows that Agni is the prime source of both health and disease. It's the core modulator of an individual's metabolism. But most of us lack the idea of how to apply it diagnostically. And today, to enlighten us on this very important topic, we have Dr. Madhu PM, Assistant Professor, Government Ayurveda College, Kannur, taking a session on relevance of Agni and Koshta in diagnosis. He's been a pioneer in this field, his important publications being Agni in Clinical Practice, Saukhyam Ayurveda Tilude, Uida River, Consultation in Ayurvedic Dermatology, and many more. He has secured his BAMS degree from VPSV Ayurveda College, Kottakkal, and secured MD from Government Ayurveda College, Kannur. He's been honored by PS Warrior All India Award in 2004, Shastra Ratna Award by Institute of Indian Scientific Heritage in 2001, PS Warrior All India Thesis Award in 1999 for Geriatrics in Ayurvedic Perspective. Undoubtedly, he is the unmatchable expertise in this field. Now, may I invite our beloved Dr. Ajit Sir, HOD, Department of Roganidanam, Sri Narayana Institute of Ayurvedic Studies and Research, to welcome Dr. Madhu Sir for today's session.
Thank you, Dr. Likita. കേൾക്കുന്നുണ്ടല്ലോ അല്ലേ? Hello.
Yes, sir.
Okay. Good evening, all, to the fifth session of the Yogya webinar series. First of all, I am welcoming our principal, Dr. Roganidanam sir, Vice Principal Pradeep sir, and Dr. Madhu sir, and dear teachers, UG and PG scholars for the seminar. While speaking about Madhu sir is now working in Government Ayurveda College, Kannur as Associate Professor, and sir has completed UG from VPSC Ayurveda College, Kottakkal, and completed his graduation from Government Ayurveda College, Kannur. Coming on to the topic, relevance of Agni and Koshta in diagnosis. Both Koshta and Agni are the basic concept of Ayurveda, basic and most important concept of Ayurveda. And before going for any treatment, we have to assess the Agni and Koshta of the individual. Otherwise, if we are not assessing that, it will be leading to serious complications. And coming on to the Agni is not merely a substance that we can diagnose in laboratories, but it is very our life itself is depending on the Agni. That is according to Acharya Charaka, Ayur, Varna, Bala, Swasthya, Utsaha, Upachaya. All are depending on Agni. And he is also saying that Shanti Agnom Riyate. That is, if the Agni stops functioning, the patient will be dying. And Yuktam Jivadi Anamaya. That is, if it is in Samavastha, the patient will be having long life. And Shanti Agnom Riyate. That is if it is stop functioning, the patient dies. And Drogi Syad Vigrdo. That is in Vigrda Avastha. That is if it is in Vishama, Tishna or Mandakni, he will be becoming Drogi. And our life itself is depending on Agni. And it is a most relevant and important topic. Once again, I am welcoming Dr. Madhu sir for the session. I am welcoming Madhu sir in behalf of SN Ayurveda College and Department of Roganidanam. Thank you, sir. Hello.
Hello, sir.
Hello, sir. Thank you.
Audible?
Yes, sir. Yes, sir.
Okay. Thank you.
Thank you, sir.
I will share my slides after some time. At the outset, let me convey my sincere gratitude to the organizers for inviting me to share some of my views regarding Agni in clinical practice, especially in clinical practice. How we can deal the concept of Agni, especially while prescribing medicine. So let me share slides. I think hello.
Hello, sir.
Full screen കാണുന്നില്ലേ? Full screen ആയിട്ട് കാണുന്നുണ്ടോ?
കാണുന്നുണ്ട് sir. കാണുന്നുണ്ട് sir.
Okay അല്ലേ? ഞാൻ പറയാലോ അല്ലേ?
Okay, sir.
Okay. So while presenting these types of titles, there is a usual way in which we will describe about the concept of Agni initially and what are the categories of Agni, Koshta Agni, Dept of Roganidanam, like that. And we will describe the importance of Agni in various clinical conditions in like that way. അതൊരു തിയറിറ്റിക്കൽ ആയിട്ടുള്ള ഒരു വേ ആയതുകൊണ്ട് തന്നെ ഞാൻ ഇന്നിവിടെ പറയാൻ ഉദ്ദേശിക്കുന്നത് വളരെ പ്രാക്ടിക്കലായിട്ട് നമ്മൾ എങ്ങനെയാണ് ക്ലിനിക്കൽ പ്രാക്ടീസിൽ അഗ്നിയുടെ കൺസെപ്റ്റ് ഉപയോഗപ്പെടുത്തേണ്ടത് എന്നുള്ളതിനെ കുറിച്ചിട്ടാണ്. എനിക്ക് തോന്നുന്നു ഈ ഡെലിഗേറ്റ്സിൽ കൂടുതലും മലയാളം അറിയുന്നവർ തന്നെയാണെന്ന് തോന്നുന്നു. കുറച്ച് ഔട്ട് ഓഫ് കേരള മാത്രമേ ഉണ്ടാവൂ തോന്നുന്നു. ഡൗട്ട്സ് ചോദിക്കുന്ന സമയത്ത് ക്ലാരിഫിക്കേഷന് വേണ്ടിയിട്ട് ഇംഗ്ലീഷ് തന്നെ ചോദിക്കാം വേണമെങ്കിൽ. ഞാൻ കൂടുതലും മലയാളത്തിൽ തന്നെ കൂടുതൽ അതിൻ്റെ ഒരു കണ്ടന്റ് കൃത്യമായിട്ട് നിങ്ങൾക്ക് മനസ്സിലാവാൻ വേണ്ടിയിട്ട്, കുറച്ചും കൂടെ ക്ലാരിറ്റിയോടുകൂടി മനസ്സിലാവാൻ വേണ്ടിയിട്ട് മലയാളത്തിൽ തന്നെ ഞാൻ ഡീൽ ചെയ്യാം. കുഴപ്പമില്ലല്ലോ അല്ലേ സാർ?
സാർ കുറച്ച് പേരുണ്ട് സാർ.
എത്ര പേരുണ്ടാവും ഏകദേശം?
സാർ ഒരു മിനിറ്റ്. അമീർ
സർ 20 പേരോളം ഉണ്ട് സർ.
20 പേരോളം ഉണ്ട് സർ.
ഓക്കെ. അപ്പോൾ നമ്മൾ രണ്ട് ലാംഗ്വേജിലും ഡീൽ ചെയ്യാം, കുഴപ്പമില്ല.
ഓക്കെ സർ. ഓക്കെ.
So while prescribing medicines, we will be having two thoughts in our mind. Let me start with the concept of clinical practice itself, because while writing a prescription, how we can incorporate the concept of Agni in that is important. Otherwise, the theoretical concepts regarding Agni, Koshta Agni, Jada Agni, Buddha Agni, that concepts, theories and all, I think you are knowing. So while writing a prescription, Nidana Parivarjana and Samprapti Vikarana. Nidana Parivarjana and Samprapti Vikarana are the synonyms of Chikitsa itself. We have to deal the management with Nidana Parivarjana and Samprapti Vikarana. That will be in our mind while writing a prescription. As you know, whenever we write a prescription, some inferences, some anumanas should be in our mind. ചില അനുമാനങ്ങൾ നമ്മുടെ മനസ്സിലുണ്ടാവണം. അതായത് ഒരു രോഗി നമ്മളെ മുന്നിൽ എത്തുമ്പോൾ instead of writing some medicines for their symptomatic cure, we have to think about the disease and that particular person in particular to write a scientific prescription. Scientific ആയിട്ട് ഒരു പ്രിസ്ക്രിപ്ഷൻ നമ്മൾ എഴുതണമെന്നുണ്ടെങ്കിൽ അതിൽ നമ്മൾ എന്തൊക്കെ ചിന്തിക്കണം? ആ രോഗി നമ്മളെ മുന്നിൽ എത്താൻ കാരണമായിട്ടുള്ള ചില സാഹചര്യങ്ങളെ കുറിച്ച് കൂടി നമ്മൾ ചിന്തിക്കണം. അങ്ങനെ ചിന്തിച്ചതിന് ശേഷം വേണം നമ്മൾ പ്രിസ്ക്രിപ്ഷൻ എഴുതാൻ. ആ രോഗത്തിലേക്ക് ലീഡ് ചെയ്തിട്ടുള്ള സാഹചര്യങ്ങളെ കുറിച്ചിട്ടുള്ള ഒരു ഏകദേശ ധാരണ നമ്മളെ മനസ്സിൽ വേണം. See how a healthy person shifts to unhealthy stage. That is an important concept. Before entering into the subject proper, we have to think about the basic pathology that happened inside their body. See, whatever may be the symptom, sometimes that may be a cervical pain, that sometimes that may be an eczema, a morphological lesion over the skin. Sometimes that may be an abdominal colic. Like that, the symptoms may vary. They are mere symptoms, mere signals. These signals are the results of some internal pathology happened inside their body. So, as you know, for every Nijavigara, as per Ayurvedic principle, for every Nijavigara, there will be certain events happened inside their body long years back or long months back. Sanjaya, Pragopa, Prasara, Sthana Samsraya. Like that, that particular course of that pathology happened inside their body, as a result of which symptoms appears inside over their body. So that concept should be in our mind while prescribing a medicine. Otherwise, mere symptomatic cure is not a principle of Ayurveda. As per Ayurveda principle, Shuddha Chikitsa should be there. We have to address the basic pathology happened inside their body. So, as you know, accumulation happens initially. Accumulation means due to various nidhanas, sometimes that may be causing an ama, sometimes that may create a pradilomata in Koshta, sometimes directly that may impair the Agni. So, Agnimandyamo, Amavastayo, Pradilomadayo, okay, കോഷ്ടത്തിൽ നിന്ന് ആരംഭിക്കുന്നതാണ് എല്ലാ പാത്തോളജിയുടെയും ആദ്യത്തെ സ്റ്റെപ്പ്. ഞാനിത് പറയാൻ കാരണം, ഇത് ഒരുപാട് ഹൗസ് സർജൻസും പുതിയ സ്റ്റുഡൻസും ഒക്കെ ഉള്ളതുകൊണ്ട് നമ്മളൊരു രോഗത്തിലേക്ക് പ്രവേശിക്കുന്നതിന് മുമ്പേ, രോഗത്തെ അഡ്രസ് ചെയ്യുന്നതിന് മുമ്പേ, രോഗത്തെ ചികിത്സിക്കുന്നതിന് മുന്നേ ആയുർവേദ കൺസെപ്റ്റ് അനുസരിച്ചിട്ട്, നമ്മുടെ സിദ്ധാന്തങ്ങൾ അനുസരിച്ചിട്ട് ഒരു ഇൻറ്റ്യൂഷൻ, അതായത് ഒരു ഉൾക്കാഴ്ച, രോഗത്തെ കുറിച്ച് ഒരു ഉൾക്കാഴ്ച കൂടി ഉണ്ടാകുമ്പോഴാണ് വളരെ കൃത്യമായിട്ടുള്ള സയന്റിഫിക് ആയിട്ടുള്ള ഒരു മരുന്നിലേക്ക്, ചില ട്രീറ്റ്മെന്റ് മൊഡാലിറ്റീസിലേക്ക് നമുക്ക് പോകാൻ കഴിയുക. അതുകൊണ്ട് എങ്ങനെയാണ് ഒരു രോഗം ഉണ്ടാവുന്നത് എന്നുള്ളതിനെ കുറിച്ചിട്ടുള്ള ഒരു ചെറിയ ധാരണ, എനിക്കറിയാം നിങ്ങൾക്ക് എല്ലാവർക്കും ഇതിനെക്കുറിച്ച് അറിയുന്നതാണ്, രോഗനിദാനവും സംപ്രാപ്തിയും ഒക്കെ അറിയുന്നതാണ്. ജസ്റ്റ് ആ തിയറി, ഹൗ വി ക്യാൻ bridge the gap between theory and practice, that is that I am trying to explore. See, the accumulation happens as a result of the dosha sanjaya or ama sanjaya or agni mandya or pradilomata in Koshta. Depending upon persons, that may vary. Some patients, in some individuals, that may be due to pradilomata. In some individuals, that may be due to ama. Some individuals, that may be due to agni mandya. Like that, the basic cause may vary. So, as a result of this sanjaya, pragopa happens, aggravation, pragopa, and that prasara, that spreads all over the body, and that localizes wherever there is a srodo vaigunya, yatra sangaha ghavaigunya vyadhi tatra upajayade. കോഷ്ടത്തിൽ നിന്ന് പ്രതിരോധമാവസ്ഥയിൽ സഞ്ചരിച്ചിട്ടുള്ള ദോഷദുഷ്ടി ശരീരത്തിൽ ഇങ്ങനെ സഞ്ചരിക്കുന്ന സമയത്ത് എവിടെയാണോ സ്രോതോ വൈഗുണ്യം ഉള്ളത്, അവിടെയാണ് ഇപ്പൊ നമുക്കറിയാം ഒരു സെബോറിക് ഡെർമറ്റൈറ്റിസ് ഉള്ള ഒരു രോഗിയുടെ തലയിൽ സ്കാൽപ്പിലാണ് എന്തുണ്ടാവുക, സ്കെയിലിംഗ് ഉണ്ടാവുന്നത്. എന്ന് വെച്ച് സ്കാൽപ്പിൽ മാത്രം നമ്മൾ ട്രീറ്റ് ചെയ്യുന്നില്ലല്ലോ. നമ്മൾ ട്രീറ്റ് ചെയ്യുന്നത് എവിടെയാണ്? കോഷ്ടത്തിലാണ് ട്രീറ്റ് ചെയ്യുന്നത്. ക്ലേദത്തിന്റെ സഞ്ചയം, ക്ലേദം എവിടെ നിന്നാണ് ജനറേറ്റ് ചെയ്യുന്നത്? ആ ജനറേറ്റിംഗ് ഹൗസ് എവിടെയാണോ അവിടെയാണ് നമ്മൾ ക്ലേദഹരമായിട്ടുള്ള മരുന്നുകൾ കൊടുക്കുന്നതും ക്ലേദഹരമായിട്ടുള്ള ആഹാര വിഹാരങ്ങൾ പറഞ്ഞു കൊടുക്കുന്നതും. അതിനുശേഷം ലോക്കലി അവിടെ സെബോറിക് ഡെർമറ്റൈറ്റിസ് ഉള്ള ഭാഗത്ത് നമ്മൾ കഴുകുകയൊക്കെ ചെയ്യും. പക്ഷേ we are treating the basic pathology at the level where the basic pathology happened. The generating house, Sanjay Apakrita dosha labande na uttaragadi. So after the sthana samsraya, manifestation occurs. Vikti and Bheda will be there. So at the level of the stomach, ആമാശയത്തിൽ നിന്നാണ് എല്ലാ രോഗങ്ങളുടെയും തുടക്കം. ആമ ഉണ്ടാവുന്നതോ അഗ്നിമാന്തി ഉണ്ടാവുന്നതും അല്ലെങ്കിൽ പ്രതിലോമത ഉണ്ടാവുന്നതും ഒക്കെയാണ് രോഗത്തിന്റെ തുടക്കം എന്ന് പറയുന്നത്. നോക്കൂ, ദി ഷിഫ്റ്റ് ഹാപ്പൻസ് ഫ്രം ദി പ്രകൃതാവസ്ഥ. പ്രകൃതാവസ്ഥയിൽ നിന്ന് ഷിഫ്റ്റ് സംഭവിക്കുന്നത് എവിടെയാണെന്ന് നോക്കൂ. ഇനീഷ്യലി
സർ I'll have to beg your pardon, sir. കുറച്ച് ഡെലിഗേറ്റ്സ് ഇംഗ്ലീഷിൽ തന്നെ ക്ലാസ് എടുക്കുമെന്ന് റിക്വസ്റ്റ് ചെയ്തിട്ടുണ്ട്. So could you please? Thank you, sir.
Okay. See,
സാറേ അത് സ്ലൈഡ് ചേഞ്ച് ചെയ്യുന്നില്ല സാറേ, അതുകൂടാതെ സ്ലൈഡ് മാറില്ലെന്ന് പറയുന്നുണ്ട്.
മാറുന്നില്ലേ?
ഇല്ല, സ്ലൈഡ് ചേഞ്ച് ആവുന്നില്ല.
മാറുന്നുണ്ടോ?
ഇപ്പൊ മാറുന്നുണ്ട് സാർ.
അപ്പൊ അത് മറ്റേ സ്ലൈഡ് ഷോയില് വലിയ സ്ക്രീനിലാണ് കാണാൻ പ്രശ്നം. ഇപ്പൊ ചേഞ്ച് ചെയ്യുന്നുണ്ട്,
ചേഞ്ച് ആവുന്നുണ്ട് സാറേ.
പ്രശ്നങ്ങളൊന്നും ഇല്ലല്ലോ?
ഇല്ല, ഇപ്പൊ പ്രകൃതി അജീർണം സാമദോഷ സ്ലൈഡാ കാണുന്നത്.
ഇത് ഫസ്റ്റ് സ്ലൈഡ് ആയിരുന്നു.
ഫസ്റ്റ് സർ.
സെക്കൻഡ് സ്ലൈഡ്. തേർഡ് വൺ.
തേർഡ്.
ഫോർത്ത് വൺ. സിഗ്നൽ സിംറ്റംസ്. So see, we have to consider every disease, every symptom, Ruba, as a signal symptom, and internal pathology will be there underneath the body. So that basic pathology will be having that Shatkriya Gala, Sanjaya Pragobari, Shatkriya Gala will be there, starting from accumulation, aggravation, spread of dosha, deposition or localization, and manifestation due to leaky gut symptom. So see, if we analyze that particular course of that manifestation from a healthy stage to unhealthy stage, why happened? How happened? See, from prakrita avastha, people may have so many derangement in their ahara viharas due to various reasons. The variations in dinacharya's, rutucharyas, ahara viharas, ashtavida ahara vidhi visheshayadanas, all that are described in our classical textbooks as a rules to obey for a healthy management of our body and mind. But see, we are not able to follow these swastavritas very regularly. We are consuming more and more apatya aharas and apatya viharas. Gradually, some derangements will happen inside our body. See, the first and initial derangement can be considered as ajirna. Three types of ajirnas are there. Vishtamba is there, Vidagdhatva is there, Ama is also is there. Ajirna dominant with Kapha is known as Ama. Ajirna dominant with Pitta is known as Vidagdhatva. And Ajirna dominant with Vada is known as Vishtabda. I know all these basic principles you know very well. But I am trying to connect these principles to practice. See, from the Ajirna stage, you see, Vidagdam, Pittadi Vidagdam, Trinmoha, Brahma, Amlodgaradaha Grida. Vishtaddanilad Shula Vinmutra Shula Vibandhatmana Sadagrat. Like that, if a person with the Sama Pitta or this Vidagdatva, that tendency of the body will be to develop a Vidagdatva. So if he consumes that type of food items, he may have Vidagdatva. Pitta the Vidagda. Pitta the Vidagdam Trinmoha Brahma Amlodgara Dahagrad. For example, if a person is having Amlodgara, acid belching, he will not be that much concerned about that symptom, Amlodgara. Temporarily, he may take some antacids to subside that Amlodgara, and he may get relief also. But he may not resume from that particular food item. He may continue that particular food item that induces that Vidagdatva. In Vishtabda, you see, Vishtabda Manilad, Shula, Vibandha, Atmana. These symptoms may be there. Temporarily, that symptoms may be there. Abdominal fullness may be there. Atmana may be there. He may not be concerned about that particular symptom, and he may take some Dhanandaram tablets or some other types of tablets that can give symptomatic relief. And at that time, that may subside, but gradually, if he consumes that particular type of food item itself, gradually that particular pathogenesis gradually shift to Samadoshavastha. Samadoshavastha means if a Amlodgara patient consumes more and more Paitika aharas or inducing that type of food items, if he is taking, then that will term as Samapittavastha. Samapittavastha. And Samapittavastha gradually turns to Pitta dosha Vruddhi. Paitika dosha Vruddhi will be there. Gradually that turns to some particular Prasaravastha. See, then dosha dusha sammurchana will happen wherever there is a Srodo Vaigunya. If he is having some Vaigunya at the level of Annavaha Srodas, that a Pitta Vidagdatva may accumulate as Amlavitta, and Rogo Ulpatti will be there. Rogo Ulpatti. Rasa Dhadu will be intermingled with that particular Vidagda Pitta and Rasa Dhadu, Dosha Dusha Sammurchana will be there, and that will manifest as ulcerations in Annavaha Srodas. Like that, Rogo Ulpatti happens. From Prakrita state, that individual turns as patient. That is the process of disease. Depending upon the individual's Srodo Vaigunya, sometimes that may present as low backache, sometimes that may present as cervical spondylitis, sometimes that may turn as psoriasis, sometimes eczema. Like that, depending upon this Srodo Vaigunya, depending upon the Dosha Dushti, depending upon the individual Prakriti and all, the manifestation may vary. രോഗോൽപത്തി എന്ന് പറയുന്നത് വളരെ വ്യത്യസ്തമായിട്ടുള്ള മാനിഫെസ്റ്റേഷൻസ് ഉണ്ടാവുമെങ്കിലും അതിൻ്റെയൊക്കെ പിന്നിലുള്ള ബേസിക് പെത്തോളജി നമ്മളൊന്ന് അനലൈസ് ചെയ്ത് കഴിഞ്ഞാൽ ഇത്തരത്തിലുള്ള ഒരു റോൾ ഓഫ് അഗ്നി വി ക്യാൻ സി. സി, as per the principle of Ayurveda, we are diagnosing the case in a holistic way. That is what is the difference between reductionist principle and holistic principle? See, as per the principle of modern science, modern medicine, if a patient is having chest pain, then they will assess the patient in terms of that particular locus, where is the lesion in his chest. So they may take, instead of the symptoms and signs, they may go for investigations, imageology. Then they will assess, they will see a particular space occupying lesion inside the chest, and they will try to remove that particular a lesion surgically for the reduction of that symptom. But as per Ayurveda, we are assessing the status of dosha, dushya, agni, srodasas, and all the related factors like ojas. So, by assessing these all factors, we are trying to prioritize. We are trying to assess the status of each and every factor involved in that particular samprapti. And we are trying to select medicines to reverse that particular status. See, if the patient is having pradilomata more, due to various reasons, pradilomata may be there. We are trying to give anuloma aushadha. If the patient is having pranavaha srodo dushti more, then we are selecting more pranavaha srodo shuddhikarana aushadhas. If the patient is having dominant vada dushti, we will select vada pacifying drugs. Like that, in our treatment protocol, there will be medicines or treatment modalities to reverse that particular samprapti. See, so as per the principle of Ayurveda, systematic diagnosis means not merely the terminological diagnosis. Not merely രോഗത്തിന്റെ പേര് മാത്രം കണ്ടുപിടിക്കുക എന്നതല്ല. Naming of the disease is not important that much. As per the principle of Ayurveda, the status of samprapti should be assessed properly. If the patient is having that much pradilomata in his koshta, then if that manifestation is at the level of brain tumor may be there. Mere removal of that surgical that tumorous growth will not cure that patient. Talavedana may, that headache may reduce for a short period of time, but after 2 or 3 months, patient may develop chest discomfort, respiratory discomfort, and that may present as a ILD, interstitial lung disease, after 2 or 3 months. Like that particular disease may shift to other system. That disease will not cure properly, completely. See, in our holistic way, we are assessing the patient as a whole, and we are trying to assess the status of samprapti ghadakas. Samprapti ഘടകങ്ങളുടെ സ്റ്റാറ്റസ് അസസ് ചെയ്യുക എന്നുള്ളതാണ് ഏത് രോഗമായാലും നമ്മുടെ മുന്നിൽ എത്തുന്ന രോഗിയുടെ സംപ്രാപ്തി ഘടകങ്ങൾ അസസ് ചെയ്യുക എന്നുള്ളതാണ് രോഗനിർണയം. See, if a patient comes with a cervical pain over the neck, then also we have to assess the status of pradilomata, amatva, this dosha dushti, dhadu vaigunya, srodo vaigunya. All these factors we have to assess. Simply writing a prescription, rasana shundyadi kashayam, for this with cervical spondylosis. If a patient comes with the psoriasis, manjishtadi kashayam. Like that the type of medicine, these prescriptions, stereotypic prescriptions are not scientific. Depending upon the individuals, samprapti may vary and drugs of choice also vary. 2-3 psoriasis patients, 1-2-3 രോഗികൾ വന്നു. We are writing different prescriptions for each and every patient because their samprapti is different. In some patients, the role of ama may not be that much relevant. In some patients, the role of that srodo vaigunya may not be that much relevant. Like that. So, Agni-oriented approach means for every presentation, we have to infer that the Agni is deranged. Derangement of Agni may be there either in Koshta, Bhuda, or Dhatu level. Koshta Agni level, Bhuda Agni level, or Dhatu Agni level. The Agni status may be impaired. That is why the presentation is there. So while we ask a question that whether you are having appetite properly, they will tell, okay, I am having proper appetite. But you see, before the presentation, they were having an Agni status which was hampered by various reasons. Due to Ahara Viharas, their Agni status hampered. Mandakni was there, and due to that Mandakni, Ama was there, and that Ama, along with this dosha, Sama dosha, and dosha dushti happens, as a result of which that due to the circulation of that dosha buddhi, that manifest this sthana samsraya occurred at the level of sodas, and manifestation happened. In that case, you see, we have to reverse the pathology. We have to reverse the pathology by reversing that ama. What reversing that ama means, there will be some ama latent inside his body, latent at the level of Koshta or at the level of dhadus. Latent ama will be there. So while starting a treatment, always you give medicines to reverse that ama. Reversal of that ama is essential. See, if we assess the content of a combination, whether it may be kashaya, arishta, churna, content of the combination, there will be some medicines essentially. While we select a baseline medicine, there should be some particular medicines intended for pajana. Pajana should be there. After pajana, deepana should be there. Agni, deepti, the effectiveness of that biofire should be there. So that deepana should be there. After that, dridhikarana of that particular biofire. Dridhikarana means the stabilization of that particular Agni should be there. Pajana, deepana, and dridhikarana of Agni. These are the intended function, objectives of a prescription, in which the medicines for pajana, deepana, and dridhikarana should be there. See, directly we can go to practice, clinical practice. Choices of intervention. You see, we select Gandharvastadi Kashaya whenever patient complains about Samavada. Samavada is the Gandharvasta Chirivillo Hudasha Vishwa Patya Punarnava Yavashaga Bhumidalai. That Yavashaga is a specific medicine intended for the Samavada. That Samavadatva Lakshanas. Vayu Ramanya Sarthi Adhmanagrita Sanjara. That symptoms will be there. Then we have to reverse that Samavadatva from the Koshta. In that case, we have to select this Gandharvastadi Kashaya. We have to ask certain questions whether you are having the symptoms of Samavada. That symptoms we have to ask. Samavada symptoms the patient may not know. So these symptoms, if they are having this amliga for a long time, you have to assess that they were having Sama Pittatva, Vidagdatva and Sama Pittatva. If they were having the symptom of fullness of abdomen for a long time before the presentation of cervical spondylitis, then we have to start the treatment with the Gandharvastadi Kashaya. If they were having the symptoms of pradilomata, constipation for a long time, we have to use Chirivilladi Kashaya for anilomana. Due to pradilomata, that Agni Mandya happens, and due to that particular Agni Mandya, he developed that particular dosha dushti and this particular samprapti. So, while taking the history, we have to be very particular about the flashback of that particular disease. ഒരു നടുവേദനയുള്ള രോഗി വന്നു കഴിഞ്ഞാൽ ആ രോഗിക്ക് കുറെ കാലം മുമ്പ് പൊളിച്ചു തേട്ടൽ, അമ്ലീക തുടങ്ങിയ ലക്ഷണങ്ങളാണ് ഉണ്ടായിരുന്നതെങ്കിൽ we have to reverse that particular LBA starting from Vidagdhatva. Starting from medicines to reverse that Vidagdhatva. See, if we are selecting a Chiruvyadi Kashaya to reverse this Pradilomada, we have to add some Avibhatti Churna along with that. So that particular Pitta Shamana is intended at that. See, Shadanga is a particular drug intended for reversal of Samapittatva, Samapitta. See, that treatment principle intended for Ajirna are the initially. In Sutrasthana itself, we can see Ajirna Shamana Aushadas. The reversal of Ajirna should be there. So that Ajirna needs some drugs or aharas or avoidance of some particular aharas. So in that way, we have to deal that patient, approach that patient by addressing the flashback. Actually, symptomatic cure is not a pure treatment. If a patient comes with shoulder pain, if you select a Guguruvita Kashaya or Rasayanandadi Kashaya, that is an unscientific treatment, because we have to assess the history. In that particular history, if they were having a history of fullness of abdomen for a long period before the presentation of shoulder pain, we have to select Chiruvyadi Kashaya or Gandharvastadi Kashaya as a baseline treatment to correct the Agni. Correct the Agni should be there. So, proper anulomana we have to reinstall. And if that patient was having the history of Vidagdhatva, Shadanga may be a good choice. If they were having a history of Sama Kabha, Amatva in Koshta, Aruji will be there. So heaviness of body will be there. All the symptoms were there before 2 or 3 years back. And after that, the symptom occurred. In that case, we can go for Panchagola Churna. Panchagola Churna is an ideal drug for Sama Kabha, Amatva. And you can start the Amrutotran Kashaya with Panchagola, like that. We are not treating the Samapitta or Samakava. We are treating a Samprapti. So, if the Samapitta is involved in that particular Samprapti, if Samapitta is involved in that particular Samprapti, then we can add Chadanga or Panchagola along with that particular medication. See, Padola Muladi is an essential Sramsana Aushadha. Sramsana means Paktavyam yada Apakta Srishtam Koshte Maladigam. If abundant Doshadushti is there, abundant Ama is there in Koshta, then that should be eliminated before Pajana. That abundant Doshadushti or abundant Ama can be eliminated with Sramsana Aushadha. And after draining that abundant Ama or Doshadushti from Koshta, we can give Pajana Aushadha. Then that the quantity of or time span of that Ama Pajana Aushadha we can reduce. Otherwise, we need a long time for Ama Pajana. If we are not giving a Sramsana Aushadha before Pajana Aushadha, then that will take a long period for Pajana. So, after giving a Sramsana Aushadha, like Padola Muladi, we can go for Pajana Aushadha. See, Panjadiktaka is an essential Pajana Aushadha. Tikta Padana is there. Kadu Padana is also there. Kadu Padana, Panchagola is a Kadu Padana Aushadha. Kadu Padana means the Amatva due to Kabha should be reversed with the Kadu Padana. Amatva due to Pitta should be dealt with the Tikta Padana. See, Panchatiktaka. See, Panchatikta Kashaya at Tikta Amrita Vrisha Padola Nidigdiga now. Tikta Amrita Vrisha Padola Nidigdiga. Tikta and Amrita. and Padola. Tikta, Amruta, Padola are the three Tikta drugs that can act at the level of Rekta also. Rekta Vahasrodas also. See, in that case, Tikta, Amruta, Vrisha and Nidigdiga. Vrisha and Nidigdiga, they are Tikta Ushadas that can act at the level of Prana Vahasrodas. So, the particular Pajana Ushada which can act at the level of Prana Vahasrodas as well as Rekta Vahasrodas. That particular drug we can give as a baseline treatment in asthma eczema syndrome. Asthma eczema syndrome. See, whatever may be the presentation, then we have to assess the basic pathology, and in basic pathology, we have to assess the status of Amatwa, status of Agni-mandya, and Agni-mandya and Ama, in which level that stays. We have to select particular drugs suitable for that particular level. That is the intention. Vaishwanara Churna, Ashta Churna. See, Vaishwanara Churna we can give in cases, in patient, whenever that particular case is having dominant Pradilomata. Dominant Pradilomata. That Abhaya is the in Vaishwanara Churna that can reverse the Pradilomata, that can clear that Pradilomata and create an Anuloma Koshta. See, Ashtajurna is indicated in Vada Gulma. If the patient is having Agni-mandya due to Vada Gulma Samprapti, then we can select that Ashtajurna in that case. That is these are some examples for the interventions, basic interventions by which we can reverse the baseline Agni impairment. See, at that during the time when we prescribe these types of medicines, Aniloman Aushadas and Amabhajana Aushadas, what should be the food items? How we have to advise them? See, while taking the Anilomana or Pajana Aushadas, if we are not advising some particular food items, they will take all the food items that can induce Pradilomata and Amatwa. Then there will not be any use for these medicines. So strictly, we have to advise them. That is why we are advising them the Pathyas. See, these are some bioenhancers or the essential ingredients which we can add to our food items. Pustaga, Indrayava, Ardraga, Shundi, Dhanyaga, Jirega, Kulatha, Mudga, Ela, Ilavanga, Ajovan, Haridra. All these items are Pajana and Agni Deeptigara. Initially, while we give Vaishwanara Churna or Ashta Churna or Gandharvastadi or Chiruladi, then we have to address the patient to take Peya, Vilebi or Yusha containing these types of bioenhancers. Then that medicines can act very, very systematically and very clearly, very speedily. Otherwise, if they are taking junk food and all, our medicines cannot act properly. Agni level, if we are treating the patients in Agni level, then that medicine should correct the Agni level. So along with these medicines, we have to advise them to take these food items also. See, in Grahani Prakarana, see, there are some particular indications or references. If Agni-mandya happened due to Adhisneha, that concept is applicable in all diseases. Agni-mandya happened due to Adhisneha should be reversed or addressed with Churna, Asava or Arishta. Agni-mandya happened due to Adhirukshatva should be treated with Taila or Sarpi. Agni-mandya happened due to Udavarta. Udavarta means Pradilomata. That should be treated with Vasti. Agni-mandya happened due to dosha vruddhi. Dosha vruddhi, as I told earlier, bulk dosha vruddhi should be treated with purgation or sramsana. Dharunatva. If the Agni-mandya is due to chronicity of disease, then we have to Snehameva param vidyad durbala anala deebanam. Very small quantity of hrida preparations, very small quantity. That can enlighten the Agni. Ama Sanjaya, Sramsana. And after Sramsana, we can give Pajana. See, this is a basic principle. See, a patient comes with diabetes. That is a Sandarpana Vyadhi. Kabaja Prameha. Sandarpana Vyadhi. Then he will complain about various symptoms. Signs and symptoms will be different. Will be there in different systems. Then we have to consider that particular disease as a Sandarpanajanya. In Sandarpanajanya Vyadhi, Adhisneha will be there. Adhisneha will be there. Adhisnigdha, that disease is due to Adhisnigdhatva, Klayadatva. We have to treat that particular case with churnas. Churna preparations or kashayas prepared with churnas also. Kashayas prepared with churnas also we can use. Kadagadradi kashaya, that Amurdarajanyadi kashaya. Like that, so many types of Pramahaushadhi powders are there, Amurdarajanyadi churnas are there. So in that case, you have to treat with various types of churnas. If asavas and aristas are there indicated for prameha, we can select that medicine also. See, Adirukshatva. If patient is having Agni-mandya due to Adirukshatva like in Gulma. In Gulma, we can see in Udavarta and Gulma, the Pradilomatu of Vada happens as a result of this Adirukshatva in Koshta. Then we can add a very small quantity of Hingu Trigona Taila, Nilgundi Eranda Taila, or a Sarpi also. Sarpi Sugumara Grada, Indaganda Grada. Very small quantity of these medicines can enlighten the Agni in Koshta. So, Gulma Rogio, അല്ലെങ്കിൽ ഉദാവർത്ത രോഗിയോ വരുമ്പോൾ നമ്മൾ ഗന്ധർവേരന്റെ തൈലം ചെറിയ അളവിൽ കൊടുക്കാം, സുകുമാര ഘൃതം കൊടുക്കാം. അതൊക്കെയാണ് അവർക്ക് അഗ്നിദീപ്തി ഉണ്ടാക്കുന്നത്. അല്ലാതെ നമ്മൾ ഈ അതിരൂക്ഷത കൊണ്ട് ഗുൽമ ഉള്ള രോഗിക്ക് അല്ലെങ്കിൽ ഉദാവർത്തുള്ള രോഗിക്ക് വീണ്ടും ഹിംഗുവചാതി ചൂർണം, അഷ്ടചൂർണം, പിന്നെ വൈശ്വാനര ചൂർണം ഇതൊന്നും ഇൻഡിക്കേറ്റ് ചെയ്യുന്നതല്ല. വി ഷുഡ് നോട്ട് പ്രിസ്ക്രൈബ് ഹിംഗുവചാതി ചൂർണ, ഐശ്വാനര ചൂർണ or അഷ്ടചൂർണ in cases where the patient is having Agni-mandya due to Adirukhatva. See, Pradilomatva, if patient is having the symptoms of Pradilomata, heaviness in abdomen and heaviness in chest, recurrent infections in chest, headache, these are the symptoms of Udavarta. If a patient complains about these symptoms, she will have that Agni-mandya due to Udavarta, Pradilomata. In that case, we have to give this Pipalyadi Anuvasana Vasti. Very specific. Very specific. പറഞ്ഞത് മനസ്സിലാവുന്നു എന്ന് വിചാരിക്കുന്നു. ഉദാവർത്തത്തിന്റെ ലക്ഷണങ്ങൾ ചെസ്റ്റിൽ ഉണ്ടാകുന്ന ഹെവിനെസ്സും അബ്ഡോമിനൽ ഹെവിനെസ്സും അല്ലെങ്കിൽ മൈഗ്രെയിൻ അല്ലെങ്കിൽ റിക്കറന്റ് ഹെഡേക്ക് തുടങ്ങിയ ലക്ഷണങ്ങളോടുകൂടി വരുന്ന രോഗിയാണെങ്കിൽ അവർക്ക് അഗ്നിമാന്ദ്യം ഉണ്ടെങ്കിൽ that Agni-mandya is due to Udavarta and you should not give Vaishwanara Churna or Ashtachurna in that case. You have to select Pipalyadina Anuvasana Vasti or that type of suppositories for the correction of that Agni-mandya. And dosha vruddhi, that much dosha vruddhi accumulated in Koshta. In that case, we have to treat that patient with purgation, like Padola Muladi. So that is the importance of Agni-oriented treatments. Whatever may be the presentation, ഏത് രോഗത്തിന്റെ presentation ആണെങ്കിലും, we have to assess, we have to take the history of that patient in detail. Detailed history of that patient will reveal that long years back or long months back, he was having that particular symptom, particular etiological reasons also. Etiological reasons which hampered, which created the Agni Mandya, which created that ama. That should be addressed properly with these types of medicines like Pajana and Devana. Not Devana Pajana, but Pajana Devana. Pajana should be the initial line of treatment. After that, we can go for Devana. Pajana and Devana. Pajanai, Devanai, Snehistan, Swedescha Parishkritan, Choded, Chodanai, Kale, Yadasannam, Yadavaram. That is the principle of Ayurveda. Pajanai, Devanai, Snehis, like that. Pajana, Devana. And after that, we can give Snehana if necessary. If necessary. Then Dharunatva, chronic disease. Chronic disease. See, due to the chronicity of disease, if you analyze the microvilli in stomach, Vata Pitta Vriddhi will be there. Due to Vata Pitta Vriddhi, that microvilli will be very dry. Dehydration of that microvilli will be there. Absorption will not happen in chronic diseases. They will be taking so many kashayas and aristas for a long time. Due to that intervention, dryness of this microvilli will be there. At that time, if we give some very small quantity of Dadi-Madhi Ghृता, very small quantity, 2 or 5 drops of Dadi-Madhi Ghृता, then that will be soothing to that microvilli, and that will help the absorption of these aharas properly. That will do rehydration. Medicinal absorptions will be very proper if we are giving that particular Snigdhatva. Ama Sanjaya, you see, in a case with a chronic eczema, in that case, we have to start the treatment Padavala Muradi or Avibhatti or Sramsana Ushada, Trivit Churna. The Sanjita dosha should be drained initially. The pacification, drainage of ama, or pacification or pajana of ama, and Agni Deepti. That is the baseline address. Baseline treatment should be at that level. Then after that, we have to address the Samprapti Ghatakas. Samprapti Ghatakas means sometimes Vata Vriddhi may be there. Sometimes Pitta Vriddhi. Sometimes Kapha Vriddhi. Theoretically. Practically, Samsarga will be there. The Sannivada will be there. So we have to take suitable drug for the particular dosha vitiation as per the dominance of doshas and dushyas. See, in theory, we can see Bhudagni is there and Dhatukni also is there. Bhudagni and Dhatukni. How we have to practice, how we have to assess these Agnis in practical sense. See, for example, I will tell one case. Patient complains about aggravation of their urticaria. Presentation of urticaria means wheals over the skin, evanescent lesions over the skin while taking particular food items like egg or milk. Milk induced the urticaria. That particular milk is not creating allergy or urticaria in all individuals. But in some individuals, that milk creates urticaria. Why? That individual is having hampered Bhudagni. He is having proper Koshta Agni. Proper appetite is there. But the hampered Bhudagni may be there. Actually, our liver contains various microenzymes for the digestion and the metabolism of various types of food items, various fragments of food items. So, for the digestion of lactogen, there may be some particular enzyme that digests this lactogen. If that particular patient lacks that enzyme, lactogen intolerance may be there. Lactogen intolerance may be there. Due to lactogen intolerance, metabolic errors may accumulate inside their this blood, and that may trigger an urticaria. So as per the principle of Ayurveda, the Bhudakni, the Bhuda contained in that particular milk, Kshira, is hampered in that particular patient. And for example, we can give musta powder, as a Bhudakni Deepana Aushada. And musta powder boiled in this milk, diluted milk. We have to dilute that milk initially, and we have to add some musta powder in that, and we have to boil that. That boiled, diluted milk we have to give to that particular individual. In that case, patient will not develop that urticaria. Initially, we have to give Padola Muladi or this Sramsan Ushada in order to drain away the accumulated dosha dushti or ama inside the body. And after that, we can give this musta powder. See, Dhatutni, for example, Dhatutni, how we have to assess. See, Dhatutni Mandya and the Amatwa Sanjay latent at the level of Dhadu is very evident in various cases. For example, in eczema, the Amatwa latent at the level of Rekta Vahasrodas or Rekta Dhadu is evident. Then how we can address that particular ama at the level of Rekta Vahasrodas or Rekta Dhadu? Then see, in Vishamajra Prakarana, there we can see the reference regarding the Kashayas, which can act at the level of Jasa, Rekta, Mamsa, and like that. Kalingagam Padola Sepatram Gadugrohini, Padola Shariva Musta, Pada Gadugrohini. Padola Shariva Musta, Pada Gadugrohini is a particular specific Gaushada Yoga which can digest the ama at the level of Rekta Vahasrodas, Rekta Dhadu. That digestion can improve the Dhatutni at the level of Rekta Vahasrodas. Rekta Dhatutni can be stimulated with the help of the Padola Shariva Musta, Pada Gadugrohini. Like that, and after that, you see the deeper dhadus are mentioned, and if we assess the various combinations described in our classical textbooks in various prakaranas, that particular combination may contain very specific medicines that can improve the dhatutni in that particular disease. A disease described in which Medo Dhadu is impaired, Medo Dhatutni is impaired. In that case, if we assess the drugs described in Prameha Prakarana, in that case, there will be some particular drugs indicated in that combination. That particular combination will act as a whole at the level of that disease. How and why? There will be some particular specific medicines that can improve the Dhatutni at the level of Medo Dhadu. Like that, you have to do an in-depth observation into the drugs described in various prakaranas. Then we can see that the combination of drugs described in our classical textbooks will contain Pajana and Devan Aushadas. As an initial or baseline treatment, we have to select that particular medicines that can improve the Agni and that can address that ama. This is the introduction of the concept of Agni in clinical practice. So I know there will be various queries regarding the Agni in clinical practice, and if you ask certain questions, I will try to answer And let me conclude here, and thanks a lot for giving an opportunity for this presentation. Thanks a lot.
Thank you so much, Madhu sir. It was an eye-opener towards many diagnostically unapproachable areas. Your expertise and your years of experience reflected throughout this session. Your peculiar way of presentation has caught us all our attention. All we expected for today was diagnostic criteria amongst many diseases, looking with respect to Agni and Koshta. But you enlightened us even more with precise presentation of interventional areas, the baseline management strategies, mentioning examples, the importance of history taking and treatment protocol. You conveyed it all so well. Thank you so much. It was such an informative session. We are sincerely grateful to you. Having said that, may I invite Dr. Ashwat Sam, Assistant Professor, Department of Sharira, Srinarayana Institute of Ayurvedic Studies and Research, to read with a proper gratitude. Ma'am, please.
Good evening, all. Good evening, Madhu sir.
Good evening, good evening. If any
So,
questions, you can ask.
questions, no, sir, actually. But I would like to tell some important points which my students need to recognize about this presentation, being a physiologist.
Okay.
Sir has very excellently told that history taking is very important in case of Agni. That's a very valid point which we usually forget in our clinical practice, because we know that every disease begins from the gut, and the chaya, prakopa, and prasara of doshas are same for all diseases. Vada chaya, Vada chaya, Vada prakopa, and Vada prasara will be same for every Vada vyadi. And that is the importance of history taking in case of Agni vyadis. And next, sir told about that was an excellent example about Agni, because I found it very difficult to explain Agni in classrooms, citing example. And next time onwards, I'll cite the same example that sir has told. And that was a very wonderful example regarding the Agni. Agni represents a transformation, and if something is absent in our body, then to transform the substance, then definitely it is Bhudagni. And then about Dhatu Agni, whatever disease from the Samprapti stage, Dhatu is involved. So whenever you want to treat Dhatu Agni, you need to take medicines, specific medicines from the Roga Prakarana, which is very beautifully told by sir. And I'm really privileged to be his student. Thank you very much, sir, from the bottom of my heart, from Srinarayana Institution, on behalf of my students, and from me also a sincere gratitude to you, sir. Thank you very much for the wonderful session.
Thank you. Thanks a lot. Good night.
Thank you, ma'am. Now it's time for the Q&A session. I request all the delegates to utilize the opportunity and clear out all your doubts regarding the topic from one of the most eminent doctors we have today. So there's a question from one of our delegates. So how to identify Agnemandya due to Rukshatva?
That is why I asked about I told about the history taking. What type of food they are taking? If, for example, you see, if they are consuming more and more food items which contain no fiber, white rice itself, they will be having constipation due to the lack of fiber contents. If they are taking more bakery items or food items that are having this maida and all, they will create Rukshatva in Koshta. So we have to identify the food items which induce that Rukshatva in Koshta. History taking is very important.
So there's another question. Is there involvement of Agni and Ama, Shita Pitta, and its management?
See, as I told in presentation, if you ask certain questions regarding their Agni, a patient with a Shita Pitta, they may not tell about the reduction in appetite, loss of appetite, or ajirnatva. Then we have to infer that Anumana Pramana. We have to infer that the Shita Pitta or this presentation is due to some type of ama at the level of Koshta or Rasa Dhadu. Very commonly in our clinical practice, we are seeing that the ama latent at the level of Rasa Dhadu creates the evanescent lesions. Evanescent lesion എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ lesion സ്കിന്നിൽ ഉണ്ടാവുകയും 2-3 മണിക്കൂറിനുള്ളിൽ താണു പോവുകയും ചെയ്യും. That will disappear within a period of 2 or 3 hours. They are known as evanescent lesions. So we have to assess that the ama stagnant at the level of Rasa creates these types of lesions, that arctic area. So Rasagada ama pajana should be there. So before giving a Rasagada ama pajana, we will give Koshta gada ama pajana aushadha like Amrudottaram kashaya or Shadharana. After that, we will go for Kalinga Gamba Dolese Patran Gadugurohini, that is explained in Vishamajara. So these types of assessment with a special reference to that particular individual should be there. We have to ask about their food habits and life habits. From that, we can assess that these types of food they can induce these types of amatwa in Koshta, or that can create Resavaha Srodo Dushti, Guru Shidam Adisigdam Adimatram Samasnadam, Resavahini Dushyandi, Chindyanam Chadi Jindanad. These types, if they are taking Guru Shidam Adisigdam Adimatram, like then we have to assess that the chances of Resavaha Srodo Dushti is there, and Resavaha Srodas may get hampered due to their food habits, and the chances we have to address with the Rasa Pajana Aushadas. So instead of giving some particular specific medicines for this Shidabitta, for example, we are prescribing a histandine tablet for this Shidabitta, then that may give a temporary result for 2 or 3 weeks. After that, patient will recur, that symptom may recur again because we have not addressed that amatwa. അതുകൊണ്ട് നമ്മൾ ആമ ഉണ്ടായിരുന്നു എന്ന് കോഷ്ടത്തിലും ധാതുവിലും ആമ ഉണ്ടായിരുന്നു എന്നുള്ളൊരു കൺസെപ്റ്റിൽ മാത്രമേ ട്രീറ്റ്മെന്റ് സ്റ്റാർട്ട് ചെയ്യാൻ പാടുള്ളൂ. അങ്ങനെ ആകുമ്പോഴാണ് അത് കംപ്ലീറ്റ് റിവേഴ്സ് ചെയ്യാൻ പറ്റുന്നത്. ഓക്കെ.
Thank you, sir. One more question. How can we use Tribhala in...
How can we?
So the question is, how can we use Tribhala in Agni Dushti? Tribhala.
Actually, in Tribhala, that combination, this Abhaya and this Ramalagi, that combination contains Abhaya. Abhaya can create a Anuloma Koshta, Anuloma in Koshta. That Anulomatva, if the patient was having Agni Mandya due to Pradilomatva, then Tribhala can create an atmosphere, Anuloma the atmosphere in Koshta. In that way, that can support the Agni. പ്രതിലോമതയുള്ള കോഷ്ടത്തിൽ നമ്മൾ അഭയ കണ്ടെയ്ൻ ചെയ്തിട്ടുള്ള ഒരു മരുന്ന് കൊടുത്തു കഴിഞ്ഞാൽ അത് ക്രിയേറ്റ് ചെയ്യുന്ന ഒരു അനുലോമ കോഷ്ടം ഉണ്ടല്ലോ, അതുകൊണ്ടുണ്ടാവുന്ന സ്റ്റെബിലൈസേഷൻ ഓഫ് അഗ്നി. ഓക്കെ.
Thank you, sir. There is another question. Is the Agni Mandya associated with various diseases same as that of the Mandagni mentioned in 3 types of Agni? Can we differentiate both if they are different?
Pardon?
Sir, is the Agni Mandya associated with various diseases same as that of the Mandagni mentioned in 3 types of Agni?
Associated with the diseases. See, as I told in presentation, associated with diseases means in that particular disease there will be involvement of Srodas, involvement of Koshta, involvement of Dosha, Dhadu, Ojas and all. So in that particular Samprapti, we have to assess the role of Srodas, Dhadu also. So in that disease, you should not consider only about the Mandagni or this Atyagni or Tishnagni. You have to consider the involved Agni Mandya at the level of Srotas also. Then, as I told in final slide, if we assess the combination of drugs described in that particular Chikitsa Prakarana, we can see particular or specific medicines that can act at the level of that particular Dhatotni or Bhudakni. Okay.
Sir, I think that's it for the session today. Thank you so much once again.
Okay.
Thank you,
Okay.
everyone.
Thank you.
Updates regarding the next session will be intimated in the group. Thank you.
Thank you.